Good afternoon, all of you. Let's go to identify what are the fluids we can use for the dengue fever patients. These are some examples. We can use milk fluids for dengue patients. It is better if you can find fresh milk than milk powder. This is soup, vegetable soup. You can prepare it from vegetable what you can find at your home. But keep in mind more fluids than solid things. This is kanji fluid, white rice kanji fluid. You can use red rice also. This is the king coconut water you can find at your home. But be careful if your patient has kidney diseases. Take a medical advice before you sit. This is lemon juice. You can prepare fruit juices like these lemon juices. But be careful if your patient has diabetic disorders. Use low sugar amount for prepare these fluids. And also you can give your patients ORS. So let's go to know how to prepare the ORS fluids. You can give ORS for dengue fever patients. Let's go how to prepare it. You want ORS packet, water, measuring cup and spoon. There are two types of ORS packet. One packet used for 1000 milliliters, other packet used for 200 milliliters. This packet is used for 1000 milliliters or 1 liter. One packet thousand milliliter or 1 liter. Other 500 water. You can prepare like this ORS and you can use for your patients for 24 hours. If remain the ORS, you can prepare another one, and all thing you should not use after 24 hours. So, can we use any kind of fluids for the patients? No, we can't use any kind of fluids. Some fluids are allowed, some fluids are not allowed. So, shall we know what are the fluids we are not allowed? Red color fluids we are not allowed, not suitable for the patients. And black color fluids are not allowed. Caffeine and black color fluids, because of patients have risk for bleeding. So we can't identify what is the reason for the bleeding, or sometimes patient has red color urine or like that. So these color fluids, red color fluids black color fluids are not allowed and not suitable for the dengue patients. And also we are not allowed some herbal fluids. Some people believe these fluids are good for the dengue patient, but the medical advice is not suitable for the dengue patients. And also soft drink we are not allowed for the patients. It is not good for your patients. And also strictly prohibited alcohol is not allowed for these patients. Okay. Let's go to recognize what is the importance of measuring fluids. Sometimes you can say you can measure fluids without the measuring cup, like this cup or like this bottle. So let's see, is it correct? Can you see like this cup? No, we can see inside. It is not transparent. So okay, let's see, this is transparent. Can we measure from like this cup, like this glass? So let's see. If you think this is a 200 milliliters, this is 100 milliliters. Let's see, it is a 100 milliliters or not. See, there is a measure 125. This fluid more than 125. So without measuring cup we can't measure the fluids. So we need to measure the fluids measuring cups, like this measuring cups, or like this. More amount of fluid you can measure from like this cup. Small amount like 100, 125 you can measure from cup. And also if a small amount you can measure like this syringe, 50 cc or 10 cc, like this syringe you can measure small amount of fluid. So let's see how to measure it. So we need to give your patient 100 milliliters. So there's a 100 mark. There is a mark. So in this mark you want to see with your eye level this mark and feel the fluids. It is the more important thing to measuring fluids for your dengue patients, because of patients has risk for fluid imbalance in their body. And the other important thing is the recording. For that you need a pen and a paper like this. Your paper you must write date, time, kind of fluids, amount and remarks. When you give your patients one time 200 milliliters, you can write the date here, what is the time, and what kind of milk, if you give what kind of fluid. If you give your patient milk, you can write milk. If you give your patient to 200 milliliters, you can write like this, 200 milliliters. It is the most important thing. And the other thing is, if your patient has any warning signs like bleeding side or vomiting or bleeding with urine or bleeding gum, any like of these, or miss fluids, if you miss the fluid of your patients, you must need to inform the health staff as soon as possible. These side steps can prevent the patients from bleeding risk and imbalanced fluid of their body. So the measuring fluids and safe recording is the important things for your patient to recover as a bride.